maybe we can start off with a few questions, and also the people that are listening can give their questions to us.
We have already 2 questions. I think 2 of them are for you. Is there a publication on the clinical validation Wheeze scan?
No, no, that's a very good question. I think it will come, especially from the group from Wisconsin. There is no publication on the clinical validation of the Wheeze scan, but I have no doubt that it will appear very soon.
The second part is, if the Wheeze scan is meant for parents, how do you mitigate the risk of a false negative result, assuming there is a severe underlying condition?
Well, I think that's also a question for me. I don't think that you cannot mitigate it, because the Wheeze scan is a very simple device. It says Wheeze or no Wheeze. And of course you have to, if parents report this, that their child wheeze, you have to do a follow-up in your own office or in your own hospital. That's of course of great importance. So it is a help in diagnosing, but your responsibility as a doctor remains the same as it was yesterday. Okay, can I ask a question? Because do you think, because we are in quite a difficult discussion, parents don't know what Wheeze is, maybe doctors know it a little bit better, but should we teach parents what Wheeze is? I know there are video programs to teach parents, but do you think that it will be of help?
Thank you, thank you. Yes, of course. We need it, because we need to explain what wheezing sound means. And that's the way we come back to the doctors. Doctors should be aware clearly what wheezing means. So having this possibility with the device, I come back and I could say that it is very useful, because I liked very much. It is not a machine saying we have crackles or any other rhonchi or wheezing. It is just wheezing or not. As the experience says, that if we come through by saying, okay, might be a mixture of crackles, and that is mycoplasma infection or anything else, we come to a confusion. From a parent, we need just to know it is wheezing or not. It is a matter of the doctor now to differentiate through the history and the clinical examination, if it is the value. And the point is to start quite early recognizing wheezing. So especially in asthmatic children, parents mainly know what is wheezing.
And it makes it easier for you as a doctor that it's most likely wheezing what the parents describe.
Yes, of course. We never forget our medical thoughts, and we ask different questions also, other questions to organize our thought. But if we have an information that we have wheezing, we come around this thought, and we could exploit correctly the information.
Yeah, okay, that's clear. Bulent, I have a question really in line with this this question. Is there any way that we can close the gap between the understanding about Wheeze between parents and physicians?
I think, thank you for this question. Also, this Wheeze scan may help also, but I think this is only the first steps. We need time, but it's very interesting and exciting, and the start of a new era. In terms of closing this gap, I think being a good physician and this, giving the right decisions all depends on the time you are spending on your patients. So when you look at all this literature, it seems that if you can get a detailed history from the parents, and if you know the background, how these respondents are behaving, because we should know this, because you cannot think that a mother and father is giving the equal history to you. A mother is always giving much more emotional way. So maybe you should be asking in Turkey, for example, is it your first child? Is this the only child you have? How old were you when you get this first child? Are you a doctor, for example? All are these important questions. So I think giving enough time and taking a detailed history will help the physicians to close this gap. And also in the future, maybe I'm thinking about this Wheeze Scan Pro for the doctors, because Kostas, you worked a lot on the terminology, but in the end, again, it's messy. So
disappointing results.
Yeah, yeah. And maybe in the end, maybe we will be needing an objective way of detecting what is V's, at least also for the physician side as well. So this will be the finish of this closing the gap project. But until then, we should be getting detailed history.
So we need to know a little bit more than at this moment, and still continue to go on with what we always did.
Yeah.
Okay.
And
yeah.
Kostas, do you think that after this task force, what should ERS do? Is there anything that ERS can do, or will be something?
Oh, yes, yeah, right. The essential point is to educate doctors, and then doctors will educate their patients, their parents. So if doctors are well educated, having in their mind what wheezing is and what is behind this sign, on the other side, when we are able the snore or every other type of noisy breathing, it is so interesting to know correctly, and then we come back to clinical practice to assess correctly our patients.
But Kostas, shouldn't we try to agree on how we call Wheeze? You showed, I think you did that, showed a list of all the different countries who have all different name for wheezing. In the Netherlands, we have the term piepen, which is what mice do. This is the sound mice make. That is piepen. So it's, I mean, why don't we call it all Wheeze, or whatever name we want to do it? It makes, as a start, it makes it.
I'm afraid it is a waste of time to try to build a name. It comes, from the inner way, and that's the name. We need to know what does it mean, and be aware from different names. You see, in this study, we're very much surprised. The only one noise which was the same in all the languages was stridor, 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 but only Greeks had different term, sigmos means. All the other languages 36 languages has the same one around stridor. So wheezing was, well, the battle was a disaster. So many terms, but still we need to know, since Sirigmos wheezing, it is the sign. We need to know correctly the sign, and then the name comes later.
Okay.
Follows.
Okay, that is reassuring. We don't have to invent a new name. I think we are coming to the end of our time, and what I like to know as a final question to Bulent, what is your approach, just your clinical approach to the first time wheeze in a child, in a young child?
Yeah, this is very tricky because when you see a child, you don't know even this. I'm just talking about the wheezing child. Is this a bronchiolitis? Is this the first time asthma attack, or is this another lung disease that we will be dealing on pediatric pulmonology? So it is very, very tricky. But how should we behave? I think the most important part of the answer to this question is, of course, we should be thinking about cat and dogs when we hear any noise from our garden, not the lions or tigers or giraffe. But there can be also a lion one day. You don't know. You cannot be sure. So I think, of course, we should be thinking about all the diseases, but we should behave the first time wheezer as they are having bronchiolitis, maybe, if they don't have any parental history of asthma, and if the patient does not have atopy, just wait and see protocol is appropriate for these kids. But it's very tricky and depends on the patient. And because of this, maybe individualized approach and personalized medicine will take over. And we should be listening to the parents much more often. And another important thing for a pediatric pulmonologist or pediatrician is keep the doors open to the parents. They should ask or any question whenever they want, and they can reach you whenever they want. Otherwise, it will be very tricky.
So the message is just go on with what you've always have done, and this new device can be maybe of help in the communication, but continue to think and continue to take care. Okay, well, thank you very much.